Well, if you are experiencing hair loss, you're definitely not alone. It's a condition that doesn't just affect men, it also affects millions of women here in the U.S.
It certainly does. And the good news is there are now more treatment options available than ever before. Dr. Katherine Kao, plastic surgeon at UT Physicians, is here to break it all down for us. Welcome, Dr. Kao. Nice to see you.
Thank you for having me on here.
And first of all, let's talk about these numbers and some of the causes of hair loss. Is it really true that about 50% of women will experience some sort of hair loss in their lifetime?
Yeah, and you know, hair loss in women is a topic that we don't talk enough about. We're comfortable talking about men and hair loss, but not women. So yes, up to 50% of women can experience hair loss at some stage of their life. The most common cause of this is androgenetic alopecia, which is a fancy term that we also apply to male pattern baldness. So if you're a woman with hair loss, you're not alone. Many women experience this as well.
And even, you know, we see hair loss or your hair changing during and after pregnancy or having a baby.
Yes,
I noticed my hair thinned quite a bit, but it then grew back fine. But it's those parts where it's not growing back is where you should really be paying attention.
Yes, that is correct. And there are lots of different causes of hair loss. When you come in for a consultation, we'll really want to tease out those causes by asking specific questions, doing a good physical exam. In women, like you said, pregnancy, stress can be a cause of hair loss, nutritional imbalances, hairstyling preferences, and also just genetic hair loss, hereditary hair loss.
We are seeing, by the way, on our screen, of course, this list of causes. And doctor, it's important to focus on what's causing the hair loss because you say for your patients, the cause of hair loss can influence the type of treatment.
Yes, that's certainly true. So for women specifically, we like to style our hair certain ways. So some women like to wear tight ponytails. If you're athletic and you need to keep your hair back, that's something you may do. But over time, that can actually pull on the follicle and cause damage and hair loss. Hair products that you use can be toxic to the hair shaft and cause breakage of the hair shaft. And heat styling can also cause damage. So if this is the cause of hair loss, we want to modify those practices. Some women also may have nutritional deficiencies like iron deficiency or vitamin deficiency. And to treat these, we would, of course, supplement those. And for women who have genetic or the male pattern type of hair loss, we can offer many treatments all the way from simple over-the-counter products to thicken the hair, to laser treatments, injectable platelet-rich plasma, and of course hair transplant.
Well, this is really interesting because a lot of times we hear, well, baldness, well, I'm just going bald, that, you know, you feel like you have to live with it. And you're talking about treatments, not only topical, but things that can be done. Traditionally, we would hear a lot about men getting hair plugs, which is that the same thing as a transplant? But everything's sort of evolving now when we're talking about this.
Everything is evolving now. So the hair plug look was something that frequently happened in the past when large chunks of the scalp were transplanted. Today, our hair transplant technique is much more fine. We isolate individual follicles from the back of the scalp. And the longevity and success of the hair transplant is based on a concept called donor dominance. So that means that the follicles on the back of the scalp will maintain their resistance to balding. And if you notice, in men with really severe balding, they still have that strip.
The patch,
Exactly. So once we transport follicles there to areas that are thinning, they'll maintain that resistance over time.
See, that is so interesting that it's hair by hair. And if someone chooses to go through this process or the treatment is right for them, describe what they can expect. I mean, is it the type of thing where you have to bring them in and put them under?
Yeah, so luckily, it's a pretty comfortable process for you as the patient. It's done in the clinic. No general anesthesia is required.
So you don't go under?
You're completely awake. We do numb up the area that we're working on, but most patients like to bring in their phones, listen to a book on tape, watch some Netflix, listen to some music, and just pass the time. The procedure can take anywhere from 4 to 8 hours, and we'll see you back the next day to do the first hair wash. You'll have some swelling, but it's a pretty comfortable procedure for patients to undergo.
And so from that point forward then, where would you see the hair growth or the amount of time?
Yeah, we typically say to give a full year to see the final results, and so patience is a virtue here.
Absolutely.
Wow, so 4 to 8 hours. I'm so
It's
fascinated. I want to come in and watch the procedure actually done. Individual hairs.
Yes.
Let's talk about some of the other services, because you also do all kinds of like rhinoplasty.
We do. We're really excited to be moving into a brand new facility with state-of-the-art equipment. We offer a range of services, including aesthetic and reconstructive. On the aesthetic side, we offer Botox, filler, thread lifts for patients who want just a little lift but aren't ready for the full facelift yet. We do offer facelift, eyelid surgery, brow lifts, as well as cosmetic rhinoplasty, and of course hair restoration. And on the reconstructive side, we offer reconstruction for head and neck cancer, skin cancers, reconstruction after gunshot wounds, trauma.
Oh my gosh.
So we do a full range of reconstructive services as well.
It's really incredible and comprehensive as well, and it's very interesting when you're not ready to make sort of those cosmetic steps for that full surgery, that there are other options to explore. And if somebody's thinking about looking at some hair replacement procedures, a quick consultation with you and the rest of the team?
Yeah, we would love to see them in the clinic. I'd love to see them for a consultation, kind of let them know what I think their hair loss is progressing as, what we can offer as a treatment option, and how we can help them.
And you can see the special offer on your screen right now. The UT Physicians Texas Center for Facial Plastic Surgery is offering that consultation totally free if you just mention Houston Life now through December 25th. If you'd like to schedule your consultation, you can call 713-486-5019. And for more information about the Center for Facial Plastic Surgery, you can visit them online at utphysicians.com. Dr. Katherine Kao, thank you so much for stopping by.
Thank you for having me. It was really great to be on here with you guys.
And I think it's important, too, to have the conversation with 33 million women affected by this.
Yes.
Here in the U.S. alone, it's nothing anyone should feel ashamed of.
Exactly. Completely agree with you.
All right. Thank you so much for
Thank
coming
you.
in. Appreciate it. Well, next on Houston Life, the